Will the Senate please come to order? We'll begin this morning with a moment of silence in lieu of a devotional. Thank you. Are there any announcements this morning? Seeing none, hearing none, we have one Senate bill for introduction. S-149, an act relating to eliminating life without parole. Please listen to the first reading of the bill.
S-49. An act relating to eliminating life without parole.
You've heard the first reading of S-149, and the bill is referred to the Committee on Judiciary. We have on the calendar for reference.
These are.
We have for reference H-444, an act relating to approval of amendments to the Charter of the City of Barrie pursuant to Temporary Rule 44. Excuse me. H-444, an act relating to approval of amendments to the Charter of the City of Barrie, introduced in the House on April 7th, 2021. Pursuant to the rules, the bill is referred to the Committee on Rules. Please listen to the first reading of H-444.
H-444. An act relating to approval of amendments to the Charter of the City of Barrie.
Excuse me, and pursuant to the rules, the bill is referred to the Committee on Rules. H-454, an act relating to approval of an amendment to the Charter of the City of Burlington. Please listen to the first reading.
H-454, an act relating to approval of an amendment to the Charter of the City of Burlington.
Pursuant to the rules, the bill is referred to the Committee on Rules. This brings us to the orders of the day. We have on the calendar for action JRH6, read for the first time on May 14th, 2021. It was referred to the Committee on Health and Welfare, which reports that it's considered the resolution and recommends that the resolution ought to pass. Please listen to the second reading of JRH6.
JRH6, joint resolution relating to racism as a public health emergency.
Dad here, the airplane.
Excuse me, Senator, kindly asked to mute. Thank you. The senator from Addison, Senator Hardy, is recognized for the report of the Committee on Health and Welfare.
Thank you, Madam President. For the past 14 months, the world has been existing in a constant state of a public health emergency brought on by a global pandemic that has killed or sickened millions of people worldwide. In order to overcome this state of emergency, most governments, institutions, businesses, families, and individuals have taken drastic measures to protect themselves and each other from COVID-19. We have shut things down, stayed home, worn masks, and foregone time together in order to stay safe. Especially in Vermont, we have taken this public health emergency seriously and done what is necessary to overcome it. Simultaneously, however, millions of Americans and thousands of Vermonters have been impacted by another public health emergency, the emergency of racism. In fact, the two emergencies have been so inextricably intertwined that the COVID-19 crisis has been called the racism pandemic due to the disproportionate negative impact of the pandemic on people of color. According to testimony from the Commissioner of Health, Vermonters of color represent 1 in 8, or nearly 13% of all COVID cases in Vermont, but only 6% of the overall population. 2 of the largest COVID outbreaks impacting Vermonters of color occurred last June in Winooski, a single community outbreak which primarily affected families living in multi-generational or crowded housing and where adults were frontline workers. And last October in Shoreham, an outbreak that impacted orchard workers from Jamaica living in crowded housing and working in close contact with each other. The fact that housing and working conditions increase the risk of COVID exposure for these individuals points to the intersectional impact of race and social determinants of health. According to the Commissioner of Health, social determinants of health are the conditions under which people are born, grow, live, work, and age. They are the social, economic, and physical environment that affect quality of life and physical and mental health risks and outcomes, including socioeconomic status, education, neighborhood, employment, social support networks, and access to health care. Current and historic policies and practices create structural inequalities and systemic discrimination based on race, gender, sexuality, class, and disability, perpetuate both implicit and explicit bias, and lead to conditions that directly determine health status and outcomes. This connection between structural inequality and health disparities has been starkly highlighted during the COVID pandemic, underscoring the serious impact of racial discrimination on the health of people of color and the detrimental and deadly results over the past 14 months. If we do not take action now to end discrimination against people of color and improve conditions under which people of color live, then the pandemic of racism will continue to persist long after COVID is eradicated. In other words, Madam President, racism is a public health emergency. So what are we going to do about it? This is the problem JRH 6 was drafted to spotlight. I'll turn now to the text of the resolution, which can be found, I believe, in an attachment emailed by the Secretary to all senators yesterday. The resolution includes 16 whereas clauses that establish the case for racism as a public health emergency. Each of these 16 clauses is supported by data from the Vermont Department of Health, the Vermont Housing Finance Agency, the Vermont Department of Mental Health, the Centers for Disease Control, and peer-reviewed health and science journals. Similar to what I've outlined, the first 3 clauses state, quote, stark and persistent health inequities exist in the United States based on race that are caused by systemic racism. And systemic racism is a principal social determinant of individual and public health, impacting economic, employment, education, housing, justice, and health opportunities and outcomes, all of which further adversely impact the health of people of color. And the COVID pandemic is now exacerbating these inequalities, unquote. The next 13 clauses outline data and statistics highlighting the health inequities experienced by people of color in Vermont, after which the resolution states that it is, quote, resolved by the Senate and House of Representatives that racism constitutes a public health emergency in Vermont. It is further resolved that this legislative body commits to the sustained and deep work of eradicating systemic racism throughout the state, actively fighting racist practices and participating in the creation of more just and equitable systems, and that this legislative body commits to coordinating work and participating in ongoing action grounded in science and data to eliminate race-based health disparities and eradicate systemic racism, unquote. More than 170 local and state leaders and public health entities have already approved similar resolutions declaring racism a public health crisis or emergency. Last month, the Centers for Disease Control declared racism a public health threat and outlined steps it will take to address it. In July 2020, the city of Burlington declared racism a public health emergency, and 30 local organizations signed on to that resolution outlining action steps they would take to end structural racism and the resulting public health emergency. State Commissioner of Health Mark Levine and State Executive Director of Racial Equity Susanna Davis announced the support of the state of Vermont and the action steps their offices would take to collaborate in that effort. Your Senate Health and Welfare Committee unanimously supports JRH 6 and voted to bring it to you today after just having officially received it from the other body on Tuesday. The other body passed the resolution as introduced, making no changes in the language. But while thorough in making a convincing argument that racism is a public health emergency, the language in the resolution is not fully inclusive of all racial and ethnic groups in Vermont. In particular, as we heard in testimony, the wording in the resolution fails to outline specific data regarding health inequities and structural racism faced by Indigenous, Native American, and Abenaki Vermonters. We will have an amendment to the resolution on third reading to correct this oversight. Given this late date in our legislative session and the urgency of the problem outlined in the resolution, the committee agreed that we need to move it forward quickly. We received testimony from public health and social justice leaders supporting the resolution, and the chair of the committee and I received dozens and dozens of communications urging us to pass the resolution immediately so that it could spur action now rather than wait until next session. We have also heard from some Vermonters that the language the other body sent us is imperfect and falls short of being fully inclusive, and therefore we wish to rectify that. We are also making the recommendation to move forward with this resolution, having already taken action this legislative session toward the work required of this resolution. For example, your Health and Welfare Committee and this body did important work on H210, which the governor signed into law on Tuesday, addressing disparities and promoting equity in the healthcare system. We improved that bill to make it more inclusive of all racial and ethnic groups, including Indigenous Vermonters, required work to better align data with acceptable racial and ethnic identities, and expanded definitions of cultural competency and cultural humility. This legislation is directly in line with the action demanded in JRH 6, and your Health and Welfare Committee is committed to returning to this important work next session, further advancing the goals of this resolution. Your Health and Welfare Committee heard from a number of witnesses, including Commissioner of Health Mark Levine, a member of the Governor's Task Force on Racial and Equity, Professor Maria Mercedes Avila, the Executive Director of the Human Rights Commission, Bora Yang, Executive Director of the Racial Justice Alliance, Mark Hughes, member of the Abenaki Nation, Joanne Crawford, the Senior Senator from Franklin, Senator Randy Brock, the reporter in the House, Representative Taylor Small, and our Legislative Counselor, Katie McGlynn. Your Committee on Health and Welfare voted 5-0-0 to pass this resolution, and we ask for your support. Thank you, Madam President.
Thank you, Senator. The question now is, shall the resolution be read for the third time? Are you ready for the question? The senator from Essex Orleans is recognized.
Madam President, I believe that we must always continue to eradicate racism where it persists. I also believe that racism is real. I also believe that Vermont is not a racist state. And when making that statement would mean that I believe Vermonters as a whole are not racist. In my personal and business life, I have found that Vermonters, when meeting people for the first time, really don't care of the color of one's skin, what God they pray to, whether you have lots of money or none, whether you are big or small, short or tall, what you've accomplished or not, what sex you identify with, nor what political affiliation you align with. Vermonters care of only one thing. Are you a good person? If you are, then you're in. Is Vermont systematically or institutionally racist? The dictionary says that institutional racism, also known as systematic racism, is a form of racism that is embedded through laws within society or an organization. If that persists in Vermont, then please let me know where it's at so we can address it today. Is racism a public health emergency? Not as defined by the National Disasters Medical Systems Federal Partners Memorandum of Agreement, which defines a public health emergency as an emergency need for medical services to respond to a disaster, significant outbreak of an infectious disease, bioterrorist attack, or other significant or catastrophic events. As for some of the findings in this joint resolution, The fact that 241 of the 251 deaths due to COVID-19, for which race and ethnicity are known, 96% are white, non-Hispanic people. According to the U.S. government census, Vermont is 94.2% white. So it does not appear that any population disproportionately has seen deaths because of systematic racism. There is a public health emergency in Vermont. It's the death of 94 people a year to opioid overdoses that's happened every year since 2009, with a 38% increase in 2020. Let's find a solution to that problem. Lastly, I want to work with every one of my colleagues to keep Vermont an inclusive state for all, as I believe it is now. But this joint resolution is something I cannot support. Thank you, Madam President.
Thank you, Senator. Are you ready for the question? Kindly unmute. All those in favor, please say aye.
Aye.
Those opposed, nay.
No.
The ayes appear to have it. The ayes do have it, and you've ordered third reading of JRH 6. We have on the calendar today S47. An act related to motor vehicle manufacturers, dealers, and warranty of. I'm going to kindly remind senators to mute if you're not speaking. Thank you. An act relating to motor vehicle manufacturers, dealers, and warranty of service facilities. The House has proposed to the Senate to amend the bill as set forth on page 2431 of today's calendar. Just to recall that the underlying question is, shall the Senate concur with the House proposal of amendment on S47? The senator from Washington, Senator Perchlik, is recognized for the report on S47.
Thank you, Madam President. Your Committee on Transportation has considered the other body's proposed amendments to S47, which I will describe really quickly. There's only two changes that, if senators remember, we passed this bill out of this chamber right before crossover. The main thrust of this bill is to allow zero emission auto manufacturers to open service centers in Vermont. In reviewing the bill, we also added a whole section around how franchised auto dealers and manufacturers interrelate through the franchise law. We had some language in there about what manufacturers can do that have franchisees in the state. The other body, their Commerce Committee, looked at it and had two changes, which basically just push out a date for two of the prohibitions on the manufacturers. We had a prohibition for manufacturers of selling auto parts. General Motors sells auto parts through their subsidiary AC Delco. They will have one more year to continue to sell those parts. There's also a prohibition for manufacturers to offer subscription services. This is a kind of a brand new thing in the auto world where you pay a subscription fee and you get a vehicle, but you could change that vehicle. It's kind of like renting a vehicle, but you're not renting it. So it's a whole new world. We don't know really where it's going, but to protect the dealers, we wanted to say that the manufacturers couldn't offer that away from the dealers. They will get another year to kind of see how that goes and figure that out. So your Committee on Transportation thought these two changes were reasonable, and we were unanimous in their support and urged the body to concur with the House instances of amendment. Thank you, Madam President.
Thank you, Senator. The question is, shall the Senate concur with the House proposal of amendment on S47? Are you ready for the question? Kindly unmute. All those in favor, please signify by saying aye.
Aye.
Those opposed, nay.
No.
The ayes appear to have it. The ayes do have it. And you've concurred with the House proposal of amendment on S47. We have on the calendar today S48, an act relating to Vermont's adoption of the Interstate Nurse Licensure Compact. The House has proposed to the Senate to amend the bill as set forth on page 2433 of today's calendar. The underlying question is, shall the Senate concur with the House proposal of amendment on S-48? The senator from Addison, Senator Hardy, is recognized for the report.
Thank you, Madam President. This is the bill on the nurse licensure compact that we passed earlier this session. The other body sent it back to us with a small amendment, which would include a report back to the legislature in 2024 regarding the number of licenses, both compact licenses and single state licenses that the Office of Professional Regulation has approved, and any funding recommendations that are required or fee changes that are required as a result of this. You may recall that there are concerns that this may increase the fees for nurse licensing. So this report is to get at get at data to ensure to understand what is going on with the number of licenses and the potential impact on fees. The amendment also removes some language that says that the Board of Nursing would set the nurse licensing fees. As you all know, the job of setting the fees is the job of the legislature. So is the Office of Professional Regulation would recommend the fees, and we would set the fees. So your Senate Health and Welfare Committee voted 5-0-0 to recommend concurrence with the House proposal of amendment, and we ask for your support. Thank you, Madam President.
Thank you, Senator. The question is, shall the Senate concur with the House proposal of amendment on S-48? Are you ready for the question? Kindly unmute. All those in favor, please say aye.
Aye.
Those opposed, nay.
Aye.
Those opposed, nay. The ayes have it. The ayes appear to have it. The ayes do have it, and you've concurred with the House proposal of amendment on S-48. This concludes the orders of the day. The senator from Windham is recognized.
Thank you, Madam President. At this time, I ask that the rules be suspended and that we message our action to the governor on S-47 and S-48.
The senator from Windham has moved that the rules be suspended and S-47 and S-48 be messaged to the governor forthwith. Are you ready for the question? Kindly unmute. All those in favor, please say aye.
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 Those opposed, nay.
Anyone opposed?
The ayes appear to have it. The ayes do have it, and you've suspended the rules and messaged S-47 and S-48 to the governor forthwith. The senator from Windham is recognized.
Any announcements? I move that the Senate stand in adjournment until 1 p.m. May 20th, this afternoon.
The senator from Windham has moved that the Senate, pending any announcements, stand in adjournment until 1 p.m. today, May 20th. Are there any announcements this morning? The senator from Washington is recognized.
Thank you, Madam President. Senate Finance will meet at 11 to talk about the miscellaneous tax bill.
Thank you. Are there any additional announcements? The senator from Chittenden, Senator Sirotkin, is recognized. Kindly unmute, Senator. Thank you.
My apologies. Thank you, Madam President. Senate Economic Development will not be meeting until after the afternoon session. Thank you.
Thank you. Are there any additional announcements? The senator from Windham has moved that the Senate adjourn until 1 p.m. this afternoon, Thursday, May 20th. Are you ready for the question? All those in favor, please unmute and say aye.
Aye.
Those opposed, nay. The ayes have it, and the Senate stands adjourned until 1 p.m. this afternoon.